The ongoing strike by resident doctors in Nigeria has entered its sixth day with no resolution in sight between the federal government and medical practitioners. Health correspondent Aminat Elegushi, who visited the Lagos University Teaching Hospital, says the wards remain deserted with no doctors on duty and patients left without access to medical or emergency care. Her report.
Days after the National Association of Resident Doctors embarked on an indefinite strike seeking the federal government to pay attention to the 19 highlighted demands, the medical practitioners say if the demands are not met, the strike will continue. With total compliance here at the Lagos University Teaching Hospital, LUTH, resident doctors are calling on the federal government to act swiftly to prevent a total collapse of tertiary healthcare services.
We have 19 demands, and that 19 demands is the minimum demand that must be met by the federal government of Nigeria. For the patient care, like we have said in our several interviews, that resident doctors are the major workforce in the hospital. We are the engine room of healthcare. So the implication of that is that the patient care would be affected. However, we have handed all patients to the consultants. That's what we have done. So which means the resident doctors no longer take responsibility for management of patients during this period of our strike.
The welfare of doctor cuts across every aspect of life. One of it is most times when someone is on call duty, especially for doctors, is 24 hours duty. That means the person resumes by 8 a.m., and then finishes the following day 8 a.m. However, he's not going home. He's going to continue what he's doing from 8 a.m. till 4 p.m. So that means it's not really 24 hours. It's about 36 hours of, consistent work. You are in the hospital. And so those times from some very unfortunate time, let me put it at that, in the night, when the person could not really go out to get meals and all is on duty, he wouldn't be able to do most of those things. He would need call duty, at least food, to be able to sustain himself.
Citing welfare and improved working conditions among their key demands, the medical practitioners say they remain committed to saving lives and are ready to return to work once their concerns are addressed. Aminat Elegushi, LTV News.